In this video, we will learn CPC exam as well as surgery live coding Q&A part 1. So if you want to pass your CPC exam, watch the video until the end. And also if you having any difficulty during the surgery live coding, watch this video until the end. These are the live coding questions you will encounter during the live coding. So after watching this session, if you feel this session is useful for you, please click on like button. So in first question, what do you code if excisional debridement classifiable to 11042 and cross excision classifiable to 11055 are performed at the same site? What procedure code should be reported? So here our keyword will be same site. So patient is performing both excisional debridement as well as the callus at the same location. So which code you will use? 11042 or 11055. So in this scenario, whenever you have confusion about which code you need to take, first we need to check the RVU value. Okay. So if you compare RVU values of 11042 and 11055, the RVU value for 11042 is high. So here you can code 11042 as your final CPT code. But the important thing here we need to remember is here patient is performing these two procedures at the same site. Okay. So because of that reason, we need to code only one code, which is 11042. For example, if the patient performs these two procedures on different sites, so that time the scenario will be you can code two codes 11042 and 11045, 11055 along with you need to append 59 modifier to 11055 as 11055 is having less RVU value. So that is the CPT guideline. So what is important here? If these procedures perform the same site, you can code 11042. If the patient performs these two procedures, excisional debridement as well as callus excision at the different sites, you can code 11042 and 11055 along with 59 modifier. Why means patient is performing these two procedures at different sites. Next question. What is the code for CO2 laser, facial resurfacing or wrinkle removal by laser? So most of the time these procedures are cosmetic purpose. So if the patient performs wrinkle removal using CO2 laser, so we don't have any permanent CPT code for this procedure. We need to use 17999, which is a unlisted code. Third question. What is the code for other abdominoplasty? So basically abdominoplasty means repair of the abdomen. Based on CPT, we have normal abdominoplasty. We need to use two codes, 15830 as well as 15847. But in this scenario, patient is not performing the regular abdominoplasty. He is performing something other than regular abdominoplasty. So that time we need to use 17999. So if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is the description of this video. And also if anyone looking for same day surgery live coding, IPDRG training, SCC training, CC certification training, please send WhatsApp message to 707-526-3939. Next question. What is the code for plantar soft tissue repair or augmentation using graft jacket as an implant for reinforcement during the procedure? Okay. So here our CPT code will be 17999. So what is plantar area? So plantar area means our foot area. Okay. So if the patient is having any complication of the plantar area of the foot related to soft tissue, so during that time patient will place implant graft jacket implant in order to augment or increase the size of the plantar tissue. So that time we need to use 17999. So this is the unlisted code. We need to use 17999 for plantar soft tissue repair augmentation using graft jacket. Next question. What is the CPT code for subcutaneous interstem pocket relocation with placement of the same device without repair? Okay, so basically patient has previous implantation of interstem pocket. Okay, now physician is performing relocation. He is not removing anything from the existing interstem pocket. Just he is relocating without any repair. So here you need to understand what is interstem pocket. So basically physician will use interstem pocket or interstem device is for urinary control. Okay, so most of the time physician will use this instrument for urinary retention or the symptoms of overactive bladder. Okay, so which will stimulate the sacral nerves. So that is the purpose of interstem pocket. So here if the patient is only relocating interstem pocket, we need to use 17999. Okay, so that is the code. Next, how do you code fat biopsies? So here also we have 17999 we can use for fat biopsy. So in order to identify any complication related to fat in the patient will perform biopsy of that fat. So we don't have any permanent CPT code for that. We need to use 17999. Next one. What is the code for facial nerve paralysis graft when using synthetic material facial suspension sling? So in the live coding, whenever you see the sling word, don't get confused. Why means in the urinary system also, in order to stop urinary control problems or urinary incontinence, physician will place the sling. So that sling and this nervous system sling both are different. Okay, so you don't code 5000 series code here. So you need to code unlisted code. Okay, so whenever you want to code facial nerve paralysis graft using synthetic material, first you need to check whether you are coding for facility or physician. Okay, for facility, so this suspension sling is included in the major procedure or main procedure. If you code for physician coding, you need to use 17999 plus you need to code HICPICS code for the synthetic graft. Okay. For facility, you don't need to code any CPT code for placing the suspension sling. For professional, you need to use 17999 plus HICPICS code for synthetic graft. Next one. Shiva, who has confirmed pathology of hidradenitis suppurativa on the chest between the breast, undergoes laser removal. How do you report this scenario? So basically, based on CPT, hidradenitis suppurativa is a benign lesion. Okay, so here you can code benign lesion excision based on your location as well as your repair type of repair mentioned in the operative report. So that time you can code from integumentary system benign lesion excision along with repair. But here in this scenario, physician has removed this hidradenitis suppurativa using laser. Okay, so here you can't use 11,000 series code. So here you need to use 17,999, which is a unlisted CPT code for laser removal of hidradenitis suppurativa. So what is important here? Whenever you want to code hidradenitis suppurativa excision or removal, you need to check what is the approach. If it is excisional approach, you can use 11,000 series. Okay. If it is other than excision, you need to use 17,999, which is a unlisted CPT code. Next one. So Kamath is a 45-year-old established patient, presents with a plantar wart located on the right plantar heel. Okay. So after an appropriate history and examination, the lesion is treated using the microneedling technique. The area is prepped with alcohol and the site is injected with lidocaine and epinephrine. These are basically for local anesthesia. Okay. A 22 gauge needle is used to repeatedly puncture the lesion in a dart-like motion to the subcutis with approximately 100 punctures. Bleeding is controlled and stopped using pressure. The patient tolerated the procedure well, and wound care and follow-up instructions were discussed and provided to the patient. Which code would be appropriate in this scenario? So here we need to use 17999. Again, this is for unlisted CPT code from the integumentary system. So basically here we don't have any permanent CPT code for microneedling technique. Okay. So because of that reason, we need to use 17999, which is a unlisted code. Code 11983 is reported for the removal of and reinsertion of a non-biodegradable drug delivery implant. What is the correct code to report removal and reinsertion of a biodegradable or bioreabsorbable implant? So basically we have CPT code for non-biodegradable drug delivery implant removal and reinsertion, where we will use 11983. So then how do you code if the same procedure patient performs for biodegradable or bioreabsorbable implant? So we have no permanent CPT code for biodegradable implant. We need to use 17999. Is it appropriate to code 15777 in conjunction with procedure code that is not listed in the integumentary system, ranges from 10,004 to 19,499, such as repairing a defect after performing an excision of mammary lymph nodes? Okay. So basically here we can't code 15777 along with 38530, as we have a CPT guideline. So 15777 is for integumentary system repairs. Okay. So we can't use this 15777 along with 38530. So what is 15777? So implantation of a biological implant for soft tissue reinforcement. Okay. So basically 15777 is for soft tissue reinforcement in the integumentary section of the CPT codes, not for the like 38,000 series codes. Next one, is it appropriate to report a complex repair if a tumor is excised from the nasal alar rim and the defect is linearly repaired with buried dermal sutures, which is followed with a second layer of surface sutures? Here patient is not performing undermining, or no undermining is performed. Okay. Here we can use complex repair CPT code. If the patient performs repair of the pre-margin of the nostril rim, we can use complex repair. Dr. Rao used pulsed dye laser PDL to devascularize hypervascular scars. However, lesions are not restricted. How do you code it? So here we need to use 17999. So PDL is one type of technique in order to devascularize hypervascular scars. Okay. So basically this condition is related to blood vessels. Vascular means blood vessel relation scar. So that time the patient uses the PDL technique, we need to use unlisted CPT code. So what is the correct code to report a fat pad biopsy? Percutaneous true cut core needle fat biopsies were obtained at the same time and same general location when the bone marrow biopsy is obtained for selected patients with myeloma and suspected amyloidosis. So basically here patient is performing two types of biopsies. Okay, fat pad as well as bone marrow at the same location. Okay, same time and same general location. So that time we need to use 17999 for fat pad biopsy, as we don't have any permanent CPT code for fat pad biopsy. Can you report 15777 for the application of a human dermal allograft? Usually you will see it as alloderm for an open repair of rotator cuff. So basically here we will not code 15777. Why means 15777 usually we need to use for soft tissue reinforcement. Okay. Mostly we will use this code along with integumentary system CPT codes like breast procedures. So other than breast or integumentary system, we can't use this 15777. What is the appropriate code to report fractional ablative CV2 laser therapy performed to treat function limiting hypertrophic burn scars? Okay, so that time we need to use 17999 for fractional limiting hypertrophic burn scar treatment using ablative CO2 laser. Sethi suffers from facial paralysis caused by Bell's palsy. Dr. Johar performs a bone anchored mid facelift with elevation of the left nostril and left lip. What is the appropriate CPT code to report this service? So basically, we don't have any permanent CPT code for mid facelift, including left nostril and left lip. We need to use 17999. What is the appropriate code to report for CO2 laser resurfacing of the facial area? So we need to use 17999 as we don't have any permanent CPT code. Like here, what would be the appropriate CPT code for wrinkle removal by laser? So here also we need to use 17999. So here, basically, how do you report if the patient performs removal of breast tissue expander insufflation port? Okay. So here he is not removing the complete breast tissue expander, just he is removing the breast tissue expander port. So during using this port, patient will inject or use the normal saline. So we don't have any CPT code for removal of only port. We need to use 17999 for if the patient removes only breast tissue expander port. Is it appropriate to report code 15780 for dermabrasion treatment? No. So basically 15780 is for dermis abrasion. Okay. So microdermabrasion means abrasion of epidermis like superficial layer. So that time we need to use 15783. So 15780 for the abrasion of epidermis plus dermis. So 15783 is for superficial layer which is epidermis. So most of the time microdermabrasion is possible with epidermal tissue. So here you need to use 15783. Okay team, so thanks for watching this video. If you like this video, please click on like button, and if you have any doubts, please mention in the comment section of this video. And also if anyone looking for same day surgery, IPDRG, HCCCS training, please send WhatsApp message to 707 526 3939.